Hey everybody, Dr. Dave Marquis here, and I had a couple of thoughts that I wanted to share specific to both male and female health, and I'm going to combine them into this one brief little video here. Many times I'll have individuals come in for genital urinary health, and on the male side of the population it usually has to do with erectile dysfunction is what the term is. I'm not really fond of that terminology. I'd prefer to focus on what's actually happening, and it's usually a vascular compromise. It's where your blood flow just isn't getting to where it needs to be adequately. So when individuals are not able to create or maintain an erection, you're looking at some type of an issue, usually with vascular health. Now there is a subset of that, and I've seen, sadly, more of late where individuals have actually changed the dynamics of their neurology and how they get to a point of arousal. And that's usually in individuals who have a history of use of pornography, because it literally changes the chemistry of how the brain works. And we've helped people with that, helping them to work through things using neurofeedback to help to change some of the chemistry of what's happened to their brain. I just want to throw that out there so that people can know that if you've had a habit of that in the past and it's impacting you negatively in terms of how your body now functions in a relationship that you would really like to have intimacy and you just can't do that, realize that there is help. And neurofeedback has great promise in that. I personally have seen many cases resolve. Usually it takes about 6 to 12 months of working with somebody neurologically, but I've seen both males and females on the outtake come back and thank me because it saved their relationship. So that's one side where we actually change how our brain functions relative to images that we see and our perceptions of others. It's a very real problem. The concept of how to work on the circulatory side, there's two components to it that I really like to help people focus on. One has to do with this category called heart rate variability, where you're actually working on sympathetic to parasympathetic tone, which is, and I'll do another video on that one, but in short, it's kind of the fast and the slow side of your autonomic nervous system, which is kind of the software of how your nervous system runs. So if an individual tends towards a fight-flight state, or they always tend towards a parasympathetic state, which is more rest and digest, and they can't keep a balance, you're going to have a hard time getting blood flow top and bottom throughout the body. So that's one topic, and that's something that most functional medicine offices should be able to help somebody with in looking at heart rate variability and teach that patient the exercises necessary to allow them to optimize the use, uptake, and delivery of their body's oxygen. So look at that as a topic. And then the last component of it actually is metabolic. And this has to do with the use of nitric oxide. And I've talked in other videos about nitric oxide, but in short, it's a gas that your blood vessels are supposed to make anytime you're active. So if you've seen bodybuilders, for example, and they're all veined out, you're looking at nitric oxide. That's what's puffing up their blood vessels. Well, if it can puff up that blood vessel, it can puff up any blood vessel. So in male and female genitalia, that is the exact same gas that is used to create and maintain any type of erectile tissue. Many people don't make nitric oxide well. And for some folks, it's genetic, and for other folks, it's actually they've damaged the blood vessels over time, and they're just not able to get the blood flow to that region. So this is where I like to introduce the concept of the use of nitric oxide precursors. And there's several out on the market, and many people will see like super beets. And beets happen to be rich in nitrates, and that helps to convert to nitric oxide. That's why that works. But for some individuals, beet extract can be a high histamine, and so it can actually have a counteractive process in their body in terms of inflaming them while simultaneously increasing a little bit of circulation. So I like to help people find out what their best tool is to use for optimizing nitric oxide. So as I mentioned, basically anything that contains a lot of nitrates, and that's why you see beets as one of them. But then also some of the precursors in the amino acid realm. So arginine, citrulline, ornithine are also good options. The only problem with the arginine is that high continual use of arginine actually pushes multiple pathways of nitric oxide. So there's inducible, neuronal, and endothelial. Those are the three different pathways that nitric oxide will go. Inducible is not a good one. It actually creates inflammation inside the lining of the blood vessel. The endothelial and neuronal, that's great. That's what you really want to push. And that's what citrulline and ornithine deliver. And so I've become a fan over the years of the use of citrulline for the purpose of pushing nitric oxide. And there's a variety of formulas on the market that will do that, and I encourage you to look into those. Citrinox is one that we use a lot of here, and it works great. I mean, I've had so many men and women come back and thank me because not only did it help them to lower their total blood pressure if they were dealing with hypertension, but they found that it also helped them in terms of male and female performance because it enhanced the vasodilation everywhere in the body, including the genitals. So that's a great tool to use on the circulatory side. Now, on the female side, one other issue that I'll commonly hear is that they're dealing with vaginal dryness. And they just don't have enough moisture because their ability to maintain their hormonal balance has shifted over the years. And there's a variety of different ways that a woman can actually balance their hormones. There's transdermals, there's injectables, there's orals. One of the ones that I like for that particular problem is actually just a direct application of vaginal suppositories. And there's vaginal suppositories that have small amounts of estriol, estradiol, and a little bit of DHEA, or even just DHEA found in basically cocoa butter. So you're not actually putting petroleum jelly inside the body. I like to avoid as much as possible adding toxins because the body is usually going to have to find a way to eliminate that and deal with it. And some people are actually highly sensitized to many of the petrochemicals. And so using some of the naturally sourced oils that we would ingest anyways is a great way to go when they have some of these other compounds like the DHEA and the estriol, estradiol in them, or even just the straight DHEA. So consider trial use of some of those types of suppositories, and you'll find that it actually very quickly enhances your moisture, not just vaginally, but all throughout the body because it's going to increase that hormonal level, and the DHEA is a precursor to many of these other sex hormones, your estrogen, your progesterone, your testosterone. So I've found good success with the use of that and would encourage you to look into each of those categories if you're struggling with function in terms of both libido and managing genital urinary performance and making sure that functionally you're intact and able to perform in the way that you would like to. I hope you find that helpful and realize that there are a lot of functional medicine docs like myself out there that do this on a daily basis, and we're all here to help you. So take control of your life, realize that there's always an answer out there. You just got to talk to the right people and get the coaching, and then you can implement that. Have a great day.